First, let's talk about the first part, which is the esophagus. Firstly, we shall speak about some congenital disorders of the esophagus, which are not very common, but they occur. First of all, is the tracheoesophageal fistula. What is meant by a fistula? A fistula is a connection between two surfaces, between the skin and an internal organ, between external surface and internal surface, or sometimes between two internal surfaces of different organs. Tracheoesophageal fistula is the connection. It is the most common esophageal anomaly and is frequently combined with some form of esophageal atresia. Atresia means the occlusion or ensidad of the esophagus. This atresia and fistula is often associated with congenital heart disease. In 90% of this type of fistula, the upper portion of the esophagus end is a blind pouch, and مسدود, and the superior end of the lower segment communicates with the trachea. And there is a connection between the lumen of the esophagus with the lumen of the trachea, and this is open, and therefore food passes from the esophagus into the trachea and then into the lungs and causes the complications and other problems due to this disorder. Other problems that include, it is not congenital here, but these are acquired and sometimes they occur in earlier ages. We call them the esophageal webs. ويب يعني شو نقول عليه مثل الغشاء أو الشبكة. Occasionally a thin mucosal membrane projects into the esophageal lumen. يعني في الشبكة أو غشاء يبرز إلى بطانة الإسوفاجس مما يؤدي إلى حدوث انسداد جزئي أو كلي في مرور الغذاء من خلال الإسوفاجس. These webs are usually single but may be multiple and can occur anywhere in the esophagus. Occasionally they can be excised with biopsy forceps during endoscopy. أثناء ما يسوون فحص الناظور يشوفوها قد يقدر الجراح أن يشيل هذه الويبس. But what are the causes of these esophageal webs? There's a disease, we call it Plummer-Vinson and sometimes also Pattern-Kelly syndrome. This syndrome, which has many causes, is characterized by cervical esophageal webs. يعني there's a web in the esophagus which is present in the neck area of at the beginning of the esophagus. Number 2, mucosal lesions in the of the mouth and pharynx, and most importantly there is iron deficiency anemia. Why iron deficiency causes these webs? It is not well known, but it is usually associated with this kind of disease, Plummer-Vinson or Patterson-Kelly syndrome, in the sense that when we give these patients, we give them iron therapy, these webs will disappear and become healed without any back side effects. Dysphagia, often associated with aspiration of swallowed food. Dysphagia, often associated with aspiration of swallowed food, and food may go into the lungs. This is the most common clinical presentation of this disease. 90% of cases occur in women, and there's a probability of carcinoma of the oropharynx and upper esophagus as a complication of this condition. So it better be treated as early. Now we come to other disorders of the esophagus which are related to the action of the esophagus. We call them motor disorders. Not the lining, not the structure of the esophagus, but the action of the esophagus. The autonomic coordination of muscular movements during swallowing is motor function that results in free passage of food through the esophagus. Not as we imagine that the esophagus is only a tube that passes food from the oral cavity down to the stomach. The tube has its own special movement that pushes the food in one-way direction, that is from up down. and this movement is sometimes disturbed, and this is of course this movement is not automatic, but it is in fact it is under the autonomic nervous system. In this motor disorder, there is difficulty in swallowing, we call it dysphagia. Dysphagia means difficulty in swallowing, and this means awareness of the bolus of food is not moving downwards, and itself it is not painful. It is not painful. You have definitely suffered from this, such a feeling when you have a thick, sometimes a dry bolus of food that cannot pass easy into your esophagus, and this is what we call dysphagia. This is awareness of يعني واحد يحس أنه اللقمة ما جاي تفوت بالesophagus, and it is not painful. Where there is pain in the esophagus, we call it odinophagia. Odinophagia is painful swallowing. Okay, and these motor disorders can be caused by either esophageal defect or systemic defect in the striated muscle function. Neurological diseases affecting the afferent nerves or peripheral neuropathies occurring and associated with diabetes. Or one important disease of the motor disease of the esophagus is the motor disease, but this is an anatomic or surgical disease, which is called a hiatal hernia. Hiatus is a presence of tissue in another in abnormal presence, in an abnormal situation. hiatal hernia يعني نسمي بالعربي احنا نسمي فتق بالحجاب الحاجز. Hiatal hernia is herniation of the stomach through an enlarged esophageal hiatus in the diaphragm. يعني اكو فد منطقة ضعيفة في جدار الحجاب الحاجز اللي تعبر من عندها المعدة into the chest cavity, من البطن إلى chest cavity. Two basic types of hiatal hernias are observed. واحدة نسميها sliding hernia والثانية نسميها para esophageal hernia. الاثنين هنا يؤدن إلى وجود المعدة بالصدر جزء من عندها أو كلها، بدل ما موجودة فقط في البطن وفقط الإسوفيغاس يربط بين المعدة من خلال الdiaphragm. In the sliding hernia, there is an enlargement of the diaphragmatic hiatus and laxity, ضعف in the circumferential connective tissue that allows a cap of gastric mucosa to move upwards to a position above the diaphragm. يعني ضعف بالwall of the diaphragm يؤدي إلى عبور جزء من المعدة إلى into the upper part of the diaphragm and into the chest wall, into the chest. This condition is common, and this type of hernia is asymptomatic in most patients. There is no symptoms. Only 5% diagnosed by radiology or symptoms related to gastroesophageal reflux، يعني عبور أصارة المعدة إلى الإسوفيغاس والألم اللي تحدثه والحموضة اللي يحدث بسببه. النوع الآخر من الهايتال هيرنيا نسميه بارا اسوفاجيال هيرنيا، يعني المعدة تعبر بصف الإسوفيغاس. This is uncommon form of hiatal hernia characterized by herniation of a portion of gastric fundus، يعني الجزء الأعلى من المعدة كله يعبر alongside the esophagus through a defect in the diaphragmatic connective tissue membrane that defines the esophageal hiatus. hiatus يعني الفتحة اللي يدخل من عندها الاسophagus into the abdominal cavity. This hernia progressively enlarged and the hiatus grows increasingly wide. In extreme cases, most of the stomach herniates into the thorax، يعني في الحالات المتقدمة قد نجد المعدة بكاملها موجودة في داخل. The clinical features of hiatal hernias, the symptoms include heartburn يسميه جالي أو الحموضة and regurgitation. These are attributed to the esophageal reflex, gastroesophageal reflex or gastric contents, primarily related to incompetence of the lower esophageal sphincter ما راح يمنع عبور الغذاء من المعدة إلى esophagus. Occasional symptoms exacerbated when the affected person is recumbent. أكثر الأحيان من يكون بوضع النائم مو بوضع الواقف وإنما الوضع الأفقي which facilitates the reflux of food back into the esophagus, and therefore most of the patients are advised to elevate the head part of their beds when they sleep. Dysphagia, painful swelling or onidophagia, and occasional bleeding may also be troubled. Large herniations carry risk of gastric volvulus, obstruction in the stomach, and intrathoracic gastric dilatation. Fair enough about the hiatal hernia. Now we come to another condition which is related to the esophagus, which is inflammation of the esophagus, or what we call esophagitis. This condition is mostly caused by reflux. Reflux يعني عصارة المعدة تعبر من المعدة تعبر into the esophageal lumen, called reflux esophagitis. Is a common cause of regurgitation of gastric contents, and this is the most common type of esophagitis. Reflux esophagitis. It's often found in conjunction with sliding, مثل ما قلنا سابقا, with sliding, hiatal hernia, and may occur with other conditions when the valve or the sphincter of the lower esophageal part is not acting properly. Pathogenesis of this condition is the most important thing is that the lower part of the esophagus is sensitive to the secretions of the stomach. Therefore, it becomes inflamed when the secretions occur down there. This reflex occurs after meals, but it is protected by the sphincter and by the recovery of the mucosa after this inflammation occurs. There are some agents that decrease the pressure of the lower esophageal sphincter, يعني ضعف السفنكتر بحيث ما تخلي يمنع الفود أن يعبر من السtomach into the esophagus. These include alcohol, chocolate, fatty foods, and smoking. And is also associated with reflux. Therefore, these conditions are usually associated with esophagitis. Certain central nervous system disease depressants like morphine, diazepam, or Valium, pregnancy, estrogen therapy, and the presence of NG tube may lead also to reflex esophagitis. Although the acid damaging to the esophageal mucosa, the combination of acid and pepsin may be particularly injurious, يعني it may cause ulceration and inflammation. There's a condition that's a manifestation after the reflex of the gastric mucosa into the esophagus. We call it Barrett esophagus. What happened here? The esophageal squamous epithelium, because of continuous inflammation, because of continuous contact with the gastric secretions, changes as a protective measure from squamous epithelium into columnar epithelium, what we call metaplasia of the esophageal squamous epithelium and replacement by columnar epithelium. This is what we call Barrett's esophagus. This is a result of chronic gastroesophageal reflux, occurs in the lower third of esophagus and may extend into higher positions. There is a slight male preponderance, يعني أكثر بالmales, and it is twofold risk among smokers. So smokers beware of this condition. What happens? There is metaplastic Barrett epithelium, usually partially involved in the circumference of the short segment, or may line the entire lower esophagus. Microscopically, we find a presence of a distinctive type of epithelium consists of a mixture of intestine-like epithelium, here columnar epithelium, and goblet cells, with gastric foveolar cells, where in the lower third of the esophagus, which is an abnormal situation or abnormal site. Complete intestinal metaplasia with Paneth cells and absorptive cells occurs occasionally in advanced cases. Inflammation may occur and some epithelial alterations. One important feature here is that Barrett's esophagus may transform into adenocarcinoma, it may transform into malignancy in this area of the lower esophagus. One important and sometimes we regard it as a complication of disease of the esophagus is the esophageal varices. Varices are مفردها varix أو dilated vein, dilated tortual vein. So esophageal varices are dilated veins which are immediately beneath the mucosa of the esophagus in the lower part that are prone to rupture and hemorrhage. They arise in the lower third of the esophagus, virtually always in patients with the cirrhosis and portal hypertension. يعني دول اللي عندهم تشمع بالكبد, fibrosis in the liver, وعندهم portal hypertension, increase in the pressure of the portal vein. What happens here that these veins become engorged, and continuously engorged they become dilated, and once dilated sometimes they become weak and rupture, and they cause this condition of esophageal varices. The lower esophageal veins are linked to the portal system through gastroesophageal anastomosis. If the portal system pressure exceeds a critical level, this anastomosis becomes prominent in the upper stomach and lower esophagus. When the varices are greater than 5 millimeters in diameter, they are prone to rupture, and this is a very serious condition, may cause life-threatening hemorrhage, and reflex injury or infective esophagitis can contribute to variceal bleeding. This is a very important in patients who suffer from liver cirrhosis or those who have portal hypertension due to any other cause. Achalasia, this is a disease related to the motor function of the esophagus. Achalasia, not achalasia, achalasia, sometimes called cardiospasm, not the heart but in the esophagus, characterized by failure of the lower esophageal sphincter to relax in response to swallowing, and the absence of peristalsis in the body of the esophagus. And the esophagus does not move, and the sphincter continues to become closed, it does not dilate when the food passes. As a result, these defects in both the outflow tract and the pumping mechanism of the esophagus, food is retained with the esophagus, and the organ hypertrophies and dilate conspicuous. يعني ببساطة السفنكتر الأسفل مال الاسوفيجس ما يتوسع من يجي يفوت الأكل. نفس الوقت الاسوفيجس العضلة مالته ما بيها بيرستالسيس حتى تدفع الفود من الأعلى إلى الأسفل into the stomach. بالنتيجة الفود راح يبقى بالاسوفيجس فيتوسع الاسوفيجس لأنه ما يطلع الفود مسدود من جوا ومن فوق ماكو إلى مجال يعبر، بس يصير عندنا dilated hypertrophied esophagus. This is what we call achalasia, usually associated with loss of or absence of ganglion cells. Ganglion cells هي الخلايا العصبية الموجودة في جدار الاسوفيجس، تكون في هذه الحالة مفقودة كليا أو جزئيا، ولهالسبب العضلة ما بها حركة. And these ganglion cells present in the myotonic plexus of the muscle in the wall of the esophagus. In Latin America, this is caused as a complication of Chagas disease, اللي هو there's destruction of the ganglion cells by Trypanosoma cruzi اللي سامعين بها العام فيها بسرطان. This phase occasionally also associated with painful swallowing or odynophagia, and regurgitation of material within the esophagus are common symptoms of achalasia. Again, carcinoma, here squamous cell carcinoma is a common complication, is also a complication. Fair enough about the esophagus. Now we shall discuss some of the pathological diseases of the stomach. As you know, the stomach is an organ which comes after the esophagus. It is present under the diaphragm in the abdominal cavity, and it has body, fundus, body, and pylorus, and it is attached distally with the duodenum. Again, we start with congenital disorders. Some of the important congenital disorders. An important one is what we call congenital pyloric stenosis. Why we talk about this? Because this is relatively a common condition that occurs in early life in children after their birth. stenosis يعني انسداد. pyloric يعني الجزء الأخير من المعدة. This is a concentric enlargement, concentric دائري يعني, of pyloric sphincter and narrowing of pyloric canal that obstruct the gastric outlet. Yes, so the stomach ما بيها شيء، بس نهاية الستومك قبل لا نحول للديودينا هاي المنطقة يصير بها تثخن بالجدار مالتها وانسداد بمجرى fluid or materials outlet of the gastric of the stomach. This is most common indication for abdominal surgery in children 6 months of life. It is 4 times more common in boys than in girls and affects the firstborn children more than subsequent. In the pathology cross-examination, the stomach shows concentric pyloric enlargement and narrowing of the pyloric canal. شلون نشوفها؟ بنسوي فحص بالناظور إلى الماء. The only consistent microscopic abnormality is extreme hypertrophy of the circular muscle. اللي نشوفه بنسوي نقص هاي المنطقة ونفحصها نشوف فقط تضخم في العضلة اللي موجودة في هذا الجزء من الاستومك اللي هو البايلورس. Clinically, there's a special type of vomiting, we call it projectile vomiting. عادة واحد من يزوع يطيح الزواع على هدومه مثلا، هذا لا مثل النافورة يعني الزواع يكون بعيد. projectile vomiting. The main symptom as usually seen within the first month of life in a child, a few months of age، في الأشهر الأولى أو في الشهر الأول من حياته. شنو نلاحظ أنه loss of hydrochloric acid and we get hypochloremic alkalosis in 1/3 of infants. Sometimes a pyloric lesion can be palpated and peristalsis are seen, visible peristalsis. Surgical incision of the hypertrophied muscle is a cure. كل اللي يسووا له أنه عملية يقصون المصل either acute or chronic. Acute hemorrhagic gastritis, which is associated with drugs and stress. This is acute hemorrhagic erosive gastritis characterized by mucosal necrosis. Erosion of the mucosa يعني ثقوب بالmucosa may extend into deeper tissues and may cause and form an ulcer تتحول إلى قرحة. This necrosis is accompanied by acute inflammatory response and hemorrhage. What is the cause? What is the pathogenesis of this condition? Most commonly associated with intake of aspirin, especially aspirin and other non-steroidal anti-inflammatory drugs, excess alcohol, and ischemic insulin. These agents injure the gastric mucosa directly and exert their effect topically. The oral administration also of corticosteroids may be complicated by acute hemorrhagic gastritis. Any serious illness that is accompanied by profound physiological alteration that requires substantial medical or surgical intervention renders the gastric mucosa more vulnerable to acute hemorrhagic gastritis because of the mucosal ischemia. This is what we call citrus. The factor common to all forms of acute hemorrhagic gastritis is thought to be the breakdown of the mucosal barrier, which permits acid-induced injury. يعني any condition which causes a weakness in the barrier between the mucosa, the epithelial cells, and the secretions of the stomach can cause the exposure of these mucosa cells to the acid and cause this. Stress ulcers and erosions occur severely in severely burned conditions, in what we call curling ulcers, and they commonly results in bleeding. Ulcerations may be deep enough to cause perforation of the stomach. Patients occasionally exhibit gastric duodenal ulcers. Sometimes central nervous system trauma, accidental or surgical ulcers, we call them Cushing ulcers, may also occur, cause citrus ulcers. So when we talk about citrus ulcers, we have two types. One of them is curling ulcer and the other is Cushing ulcer. These ulcers may also occur in the esophagus and the duodenum. They are characterized by become deep and carry substantial risk of perforation. Severe trauma, especially when accompanied by shock, prolonged sepsis, and incapacitation from debilitated disease, also predispose development of acute hemorrhagic gastritis. Hypersecretion of gastric acid has been incriminated in the pathogenesis of hemorrhagic gastritis. يعني حتى الأمراض المزمنة قد تؤدي إلى حدوث acute hemorrhagic. What we see in the pathology of hemorrhagic gastritis, there is widespread petechial hemorrhages in any portion of the stomach or region of confluent mucosal or submucosal lesion. Lesions vary from 1 to 25 millimeters across and appear occasionally as sharply punched out ulcers. Microscopically, patchy mucosal necrosis, which can extend to submucosa, visualized adjacent mucosa. Fair enough about the acute gastritis. Now we come to chronic gastritis. Chronic gastritis refers to chronic inflammatory disease of the stomach, which may be mild, superficial, involving the superficial mucosa, to severe atrophy of the mucosa. Predominant symptom is dyspepsia. This is another and a new term, dyspepsia. This is difficulty in digestion of food. The diseases are also commonly discovered in asymptomatic persons undergoing routine endoscopic screening. يعني عدد كبير من البيشنتس عندهم chronic gastritis وعندهم dyspepsia بس ما يدرون, were only occasionally discovered when they do endoscopic examination for another cause, يعني insurance أو عند حالة أخرى سوي endoscopy يشوفون عند chronic gastritis. One important type of chronic gastritis is autoimmune atrophic gastritis, which is associated with what we call pernicious anemia. This type of gastritis is a chronic diffuse inflammatory disease of the stomach that is restricted to the body and fundus, with sparing of the pylorus. This disorder exhibits diffuse atrophic gastritis. يعني عندنا atrophic gastritis مو فقط gastritis. There is atrophy of the gastric mucosa involving the body and fundus with lack or minimal involvement of the antrum. Presence of here شنو بعد عندنا موجودة involved presence of antibodies against the parietal cells and antibodies against the intrinsic factor. There is also significant reduction or absence of gastric secretions, including acid, with increased serum gastrin because of G-cell hyperplasia of the antral mucosa. This type of anemia, pernicious anemia, is a type of megaloblastic anemia caused by deficiency of vitamin B12 because of malabsorption of vitamin B12. Vitamin B12 needs the intrinsic factor so that it is absorbed, and here there is deficiency of intrinsic factor, deficiency either in the absorption or destruction of these to the intrinsic. A new term, intestinal metaplasia. We are talking about the stomach, not intestine. But this what happens here, that the mucosa of the intestine changes from gastric mucosa into intestinal mucosa. This is what we call intestinal metaplasia. This is a common and important histological feature of autoimmune and multifocal type of atrophic gastritis. In response to injury of gastric mucosa, normal epithelium is replaced by one composed of cells of intestinal type. Here we find goblet cells, we find enterocytes, crypt-like glands, we find also parent cells, and even intestinal villi in the stomach, which is a very abnormal. Peptic ulcer disease أو القرحة المعدية أو القرحة الاثني عشر أو القرحة بصورة. Peptic ulcer disease refers to focal destruction of gastric mucosa and the small intestine. يعني peptic يعني ما مختصر فقط على المعدة، وإنما المعدة والأمعاء. Principally the proximal duodenum caused by the action of gastric secretion. لهالسبب سميناه peptic ulcer نسبة إلى pepsin, which is secreted in the stomach. So peptic ulcer is ulceration in the gastric mucosa and in the beginning of the intestine, which is the duodenum. So duodenal ulcer or gastric ulcer. This is caused by the action of gastric secretion. 10% of population of Western industrialized countries may develop such ulcer sometimes during their lives. These gastric or duodenal ulcers have unique features. For practical purposes, peptic ulcer disease affects the distal stomach and the proximal duodenum. Pathogenesis. There are numerous etiologic factors. Pathogenesis of peptic ulcer, but no single agents. Of these factors, we have the environmental factors and the congenital factors. The environmental factors include the diet, some foods like coffee, alcohol, contribute development of persistent peptic ulcers. However, cirrhosis from any cause associated with peptic ulcer. Drugs, again, non-steroidal anti-inflammatories, aspirin, and analgesics. Cigarette smokers are more affected with gastric ulcer than non-smokers. Genetic factors. First-degree relatives, people with duodenal ulcers, have 3-fold increased risk of developing an ulcer. Identical twins with 50% concordance. Blood group antigens risk for duodenal ulcers, not the gastric ulcer, is 30% higher in person to blood group O. Duodenal ulcers, they get blood group O, they get 30% increase than the normal population. People who do not secrete blood group antigens in saliva or gastric juice carry 50% increased risk for duodenal ulcers. Pepsinogen 1, which is a person with high circulating level of pepsinogen 1 have 5 times the normal risk for developing duodenal ulcers. So when we find this pepsinogen 1 in their serum, we see that they have high probability Now we come to another subject. It is about the small intestine. First we talk about a common condition in the small intestine pathology, which is infections of the small intestine. Many of us have suffered from infections of the small intestine, usually presents in the form of diarrhea, which is particularly lethal in infants and children living in underdeveloped countries. The small bowel normally has a few bacteria. The part of the intestine which contains the largest amount of bacteria is the large intestine, the colon. It is not the small intestine. Usually the small intestine contains very small amount of bacteria, which are mostly aerobic, like lactobacilli, and ordinarily do not colonize the small intestine. Infectious diarrhea is caused by bacterial colonization, for example with toxigenic strain of Escherichia coli and Vibrio cholerae. The most significant factor of infectious diarrhea is increased intestinal secretions. أهم عامل هو increased intestinal secretions, which is stimulated by bacterial toxins and enteric hormones. The decreased absorption and increased peristaltic activity contributes less to the diarrhea. يعني المشكلة أنه زيادة بالإفرازات اللي تحفزها وجود toxins produced by the bacteria هي المشكلة، وهي اللي تسبب لنا زيادة عدد مرات الخروج اللي هي نسميها diarrhea. The agents of infectious diarrhea are conveniently classified into نقسمها العوامل اللي تأثر وتسبب لنا diarrhea. الانفكشوس diarrhea عادة اللي هي بكتيريا، قسمت toxigenic organisms مثل Vibrio cholerae and toxigenic strains of E. coli, which produce diarrhea by elaborating toxins, and invasive bacteria من ضمنها Shigella and Salmonella and certain strains of E. coli. Yersinia and Campylobacter are the most widely recognized. إذن عندنا نوعين أساسية من infectious cause of. أكو نوع آخر من الدياريا اللي هي بسبب الفيروسز. rotaviruses, which are infectious agents or that cause rotavirus infection. Common cause of infantile يعني الرضع. Infantile diarrhea accounts for about half of acute diarrhea hospitalized in children younger than 2 years old. Rotavirus has been demonstrated in duodenal biopsy specimen associated with injury to the surface epithelium and impaired intestinal absorption for periods up to the virus targets the upper small intestine where it causes patchy mucosal lesion and malabsorption. Vomiting and diarrhea are usual and symptoms resolve within 2 days. Okay. To end the lecture, we finish with this subject, which is about malabsorption. Malabsorption عدم الامتصاص أو قلة امتصاص المواد الغذائية من main function of the small intestine is absorption of everything that enters from water into the large molecular components of. Malabsorption is a general term that describes a number of clinical conditions in which important nutrients are inadequately absorbed by the GIT. Although some nutrients absorption occur in the stomach and colon, only absorption from the small intestine is clinically important. يعني حتى لو شفنا أن الستومك والكولون تمتص عدد كبير من المواد الغذائية، نسبيا الأغلبية والأهم هي اللي تصير بالسمول intestine. Normal intestinal absorption is characterized by luminal phase and intestinal phase. شنو الفرق بينهم؟ The luminal phase consisting of those processes that occur within the lumen of the small intestine داخل cavity of small intestine. شو يصير هنا؟ There's alteration in the physicochemical state of various nutrients so that they can be taken up by the small bowel absorptive cells. يعني larger molecules of starch and sugars. They are broken down into smaller molecules, those of the proteins into smaller amino acids and polypeptides, and those of fats also. This occurs in the lumen of the smooth, therefore we call it luminal digestive phase. بينما in the luminal phase of intestinal absorption, the bile acids must be secreted into the pancreatic enzymes. Duodenal lumen is in adequate amounts in the normal physicochemical condition. Regulated flow of gastric contents into duodenal at the appropriate pH. The intestinal phase includes those processes that occur in the cells and transport channels of the